Good afternoon, friends. Basically, we are here to discuss about the gastrointestinal agents. Before we move further, let me introduce myself. I am Bhushan Kodi. I am assistant professor, associate professor at TID Pharmacy since last 23 years, and I have learned quite a lot. Is teaching on the best thing which I have heard did by B Pharma and M Pharma from Dr. Hari Singh Gaur University, 2000 and 2002. Since then, I have been teaching. So we should directly come to the topic. This is from inorganic chemistry for basically first year or second year students. These are called as gastrointestinal agents. You might have heard about it. They primarily act on the stomach and the intestine. They are basically inorganic in nature. There are broadly classified into these following types, which are acidifiers, antacids, protectives, absorbents, laxative, cathartics, and other agents. Basically, all these 5 or 6 categories, they are because of this particular mechanism of action. Normally, products which are altering the gastric pH, for example, we had just mentioned here, antacids, which act against the acid which is produced more inside the body, and acidifiers. When some patients who do not have more amount of the acids, so we have to give this acidifiers for this thing. The first one, acidifying agents. Normally, then there is protective and absorbent. They basically act for various inflammations, diarrhea, dysentery, and the various intestinal toxins, maybe bacteria, virus, or fungus. Then there's the final category, that is the cathartics or laxatives, and there is one important topic, purgative, which increase the gastric motilation. So motility is increased because of these cathartics, which are mainly basic in nature. From acidifiers, we have NH4Cl, dilute HCl, which increase the acid inside the body. Then there are antacids, which are, for example, basic in nature. Bicarbonates, they may be from aluminium, magnesium, and sodium bicarbonate. This is aluminum hydroxide gel, which is also called as important gel preparation because it is solid in nature. It should not be absorbed from the intestine, so we have to give it in some form which is normally increases the GI. Now this magnesium hydroxide mixture we shall be discussing further, also called as milk of magnesia. In cathartics or purgatives or laxative, we have again magnesium sulfate and sodium orthophosphate. Now these two things, purine and ventorin, again are very important. Then we have these antimicrobials, which are again for decreasing the inflammation and diarrhea and dysentery. They are basically acidic in nature, hydrogen peroxide, cleaning agents, and chlorinated lime, iodine and its preparations, which we normally know as povidone iodine, जो हम use करते हैं. Here, there two conditions are there which are very much responsible for the use of acidifiers and antacids. Normally, a patient who has a good digestive system, he produces acids in a particular form. But if somehow he is not able to produce acid, then this is called as hypochlorhydria, and there is hyperchlorhydria, which is more amount of the acid is being secreted. This hyperchlorhydria means is the main cause of hyperacidity or ulcers, which is the eating of the mucosa. Hypochlorhydria, which is normally very much present as a disease. Antacids are quite very important, and these are used for hypochlorhydria. Next, we are here with normally acidifiers, dilute HCl, just discussed. Antacids are the major class of drugs which are more alkaline in nature, basically because they have to react with the acid, and they are, for example, bicarbonate, sodium bicarbonate, HCO3 minus, again aluminum hydroxide, milk of magnesia, and calcium plus 3 phosphates, and other phosphates are also there. Here, the final category which are acting more on the intestine, these are protective and absorbent. For example, they are substances, inert substances. We do not react very much, do not go inside the blood. They are used for the treatment of diarrhea, dastaraka, dysentery, and normally for the small children. They also have the property to absorb the poisons, which are normally called as the gases, toxins, and bacteria. Now, we have here example again the subbicarbonate is HCO3 minus. We have bismuth subnitrate, milk of bismuth, again a sort of bismuth which we will be seeing next further. cathartics which are used mainly for diseases called as constipation, upach. They are, although we do have some organic sources also, but prior to this discoveries, we have cathartics which were used quite nicely, magnesium hydroxide, sodium phosphate tartrate, and other calcium containing hydroxide. They also remove intestinal parasites which normally get killed after the use of the drug. Now, so they should be removed from the body. Again, purgatives and laxatives, they are also cathartics which are of lesser power, that's why they are milder cathartics. Laxatives which are much less power than the purgatives, which are giving the same effect. All the purgative and laxative give the same effect. Normally, by changing the concentration also, we can change the category of the drugs. Laxatives, magnesium sulfate, sodium phosphate, and for purgatives we have potassium bicarbonate. Now, this is the normal area where these inorganic drugs are normally active. Right from the mouth to the anus, normally it acts basically from the stomach and the intestine, both the small intestine and the large intestine, and most of the bacteria, virus and the microbes do get quite effect in the intestine and the stomach, so they are to be removed from there. First they have to be killed there, and only if when they are killed they have to be removed from the body. This is by increasing the motility. Now this is a general discussion about again the same conditions. Lesser of amount of the acid, hypochlorhydria, more amount of the acid which is called as hyperacidity or ulcers, diarrhea, dust like the constipation, lesser amount of water is produced inside the body. So what happens here is that due to the deficiency of the water, there may be inadequate secretion of saliva or some fluids from the body. So this may result in indigestion also. So this poisonous substances should be removed from the body. It is possible to correct these above conditions all by suitable inorganic drugs, which we normally refer to as GI agents. The area of action is gastrointestinal tracts. Again, acidifying agents we have broadly classified into gastric acidifiers, urinary, systemic acidifiers, antacids. Then we have examples of which molecules are being used to create that basic salts of antacid. They are aluminium salts, aluminium hydroxide, calcium salts, calcium carbonate, and tribasic calcium phosphate, Ca3PO4, magnesium, and this one is quite important, combination of antacid preparation, because normally patients do require a different sort of mechanism, because generally milk of magnesia and combination is being prescribed for the patient because they have more of the effect, they have the lesser amount of side effects also. Now, so finally, which is the antimicrobials, and they are normally act against the microbes, maybe static or attenuation. They are normally referred to as protective and absorbent. Now, there are also disinfectants and all that. They may be acting on the external surfaces or the body tissues. For example, antibacterials also. Normally, we have the fourth class. We have laxative, cathartic, purgative, which has already been discussed. They are broadly classified into four main types. Stimulants, which stimulate the motility of the gastric tract, especially in the intestine, by increasing the amount of water and fluidity. Then there are bulk purgative, which increase the mass of the food or the whatever is in the intestine. Then there are lubricants, they smoothen our GI system, especially the intestine. Then there are saline cathartics, magnesium hydroxide and magnesium sulfate. They have multiple examples. Just depending upon the dose, we may also use them as purgatives or laxatives. Acidifying agents, gastric acidifiers, urinary acidifiers, systemic acidifiers, normally based upon the particular area where they are acting. If they are acting on the stomach, they are normally for stomach or ulcers patients, achlorhydria or hypochlorhydria, urinary acidifiers for rendering the acidic urine to enable in the treatment of some disorders, urinary disorders. Systemic acidifiers which get absorbed inside the body, may go inside the blood, and the patient may have a problem which is called as systemic alkalosis. The blood is already alkaline, so a huge amount of systemic acidifiers may cause more amount of the basicity. We have to keep that in mind, particularly for patient. So simple other antacids which are not absorbed are quite safe for that. Acids, normally this is not given to the patient, this is used only for laboratory practical purposes, and other than that, normally acid is not given to any of the patients. Here, these are the details of dilute hydrochloric acid. It is quite dilute in nature, nearly 10% or more, less than that. This is the preparation of in situ preparation. We have to freshly prepared it by using of NaCl and sulfuric acid, where HCl is produced in the form of and there is sodium hyposulfate. Then these are the byproducts of it. There are other properties of HCl, normally which is not being given as acidifier, so we shall move forward. There are various identification tests, test of purity. Now this is very important because the quality of the inorganic chemicals, because they are originated from the inorganic sources, so we have to keep this in mind, that their purity should be of particular level. For the most important thing, how to check the purity or the percentage, we have assay. As you say, this is for this particular thing we have to follow the Indian pharmacopoeia or the other pharmacopoeias, in which there is exclusively detailed study of how to calculate the product inorganic which you have prepared is of particular quality or not. We have specification 4 gram of HCl has to be taken into a flask. It is diluted in water. Now this has to be treated with some opposite basic in nature, that is 1 normal NaOH, and proper indicator should be definitely used for the titration. And there are storage and uses conditions. Storage should be quite well to store in a cool and dark place. Normally it is used as pharmaceutical aid, for gastric acidifier. Externally it is also used as for laboratory purposes also. Antacids, normally, as we have already stated here, diagrams are much more important, because when we see here this yellow color of this inside the stomach, which shows that a huge amount of acid is produced, it's sort of for irritation, jalan jaisa, some sort of a fire inside the stomach. So this become inconvenient for the patient. Even if you don't have these drugs immediately for our retrieval, we can take small amount of water also, which can at least ease our irritation. So we should have this particular thing in mind, that we should take our food at a particular time, so that no extra amount of acid base is produced inside the stomach. Otherwise we have to go for taking the drug. Next we have again systemic and non-systemic. Systemics are the antacids which get absorbed inside the blood from the stomach and the intestine, which may cause alkalosis, for example sodium bicarbonate. Because for this thing, because systemic may become a problem for the patient, so we have non-systemic antacids which are aluminum, calcium or magnesium based, which are not get absorbed inside the blood, so they are quite safe to use. For example, milk of magnesia. Then there is combination of antacids, aluminum hydroxide gel and magnesium hydroxide gel, milk of magnesia and other. We have some other salts also, other from hydroxide. Other than the hydroxide, we have peroxides, trisilicates, magnesium phosphates also. Next, these are the ideal conditions water antacid should have. It should be insoluble in water, so that it will be in the form of particles and it will get absorbed, and it will not be absorbed. Otherwise, it will cause systemic alkalosis. So better it should get passed from the intestine and all that. It should not have any longer period of presence inside the body. It should be or help in constipation also. It should not have more of the side effects also. It should be easily available. Antacids, the buffer pH is quite important, because if it gets absorbed, it may produce problem or something for the proteins also. Evacuation of the antacid is again done for if more amount of antacids is given. These are the details of aluminum hydroxide gel. Again, this is, as we know, it is insoluble, so this is in the form of suspension. Basic ammonium carbonate, aluminum hydroxide gel. Now this is 0.05%, and other flavoring agents, methyl oil and other things are to be added, for example, to preserve them. Now again, the preparation is by taking 2 inorganic chemicals, sodium carbonate and the potash alum as 0, and with the amount of water, which produces this aluminum hydroxide gel. Precaution, again, alum should be added with the solution of carbonate and vice versa. These specifications are quite very well important, especially when you are preparing this aluminum hydroxide gel inside the lab or in situ preparation. Next, we have these properties of aluminum hydroxide gel. This aluminum hydroxide, when reacts with the extra amount of acid which is causing irritation inside the stomach, this will produce a salt which is ELCL3, which is easily removed from the body. So we don't have any much of the problem. Again, this aluminum hydroxide reacts with the water also. So this forms aluminum, other things also here. These also have astringent effects. By this action of aluminum hydroxide gel, AlCl3, when HCl is removed, we have very fast acting preparations also, sort of आपने जैसा सुना होगा इनो वगैरह होता है. So it releases our irritation or ulcers immediately also. So these preparations are also quite well used, because immediately any base, whether it is calcium salt or aluminum salt, it goes inside the stomach, reacts with the HCl and forms the sequential salts. Here this is non-absorbable, these are the qualities. Here we are in the same way, we have other drugs also. If they are not given with the antacid, then it's quite good for us. Next we have assay. We have this particular titration method where we are going to detect each and exact amount of purity of the drugs. Next we have this marketed preparations, digifer. Again, there are various specifications as per the ingredients which are written here. This is 50 milligrams as per Indian pharmacopoeia, and other details are indications are given here. Only in the cases of hyperacidity, peptic ulcer, reflux, erosion, dyspepsia and other diseases. Similarly, we have this magnesium containing antacids, which is the milk of magnesia, magnesium oxide, peroxide. Here from next, these are again the same preparation. In the same way, what we have here is magnesium hydroxide reacts with the base to form magnesium hydroxide. This again, magnesium hydroxide will go inside the stomach and react with the extra amount of acid which is produced inside the body. In the same way, this is acid, this is simple acid base neutralization reaction, जो कि हम normally students को कराते रहते हैं. So it is quite easy to check the quality. Calcium containing antacids, again the same, calcium carbonate, tribasic, and then we have this megaltrate. This is the combination. These are the brand names. And Simico tablets, all these are chewable tablet. Powder of form also is available there. Next we should move forward. Calcium and aluminium containing are used for constipating. Magnesium is basically wider in action, so this is used for laxation effect. Then we have this protective and adsorbent. Now these are the again very important class of drugs, because they act to remove the microbes from the body. They are inert in action, because we don't want any amount of disturbance to our gastrointestinal system. They have the ability to absorb the toxins and the bacteria, normally used for diarrhea and dysentery. Many of the chemical agents which are used for diarrhea, they are also called as protective and adsorbents in nature. For example, subcarbonates, kaolin, you must have heard the name here. Then there are insoluble salts, protective and adsorbent as per the requirement. They absorb the bacterial toxins whether they die off or they are still alive. Then they also stimulate the flow of electrolytes inside the intestine, causing watery stool, so that it is removed from the body. These are the mucosal area from where this normally our products act, and they loosen the mucus which is present in the stomach. Here we have bismuth subcarbonate. Here there is a preparation. Bismuth reacts with sodium carbonate to form bismuth subcarbonate. Again, it is the various details are here. This is white powder, odorless, tasteless. Most of the drugs which are used as inorganic drugs are odorless, tasteless, and they do not have, normally they are white in color also. We should move forward. Assay is done by gravimetric method. Here we use the precipitation titration methods. They are used as astringent and adsorbent. They are topically externally used as protective. Next we have laxative, cathartic, purgative. The side effect, if huge amount of these laxative or cathartic drugs, they may cause diarrhea to the patient. So it is quite important how much amount of the drug is to be given to the patient. Otherwise, because we are here to smoothen the GI system, if more amount of the drug is given, they may be harmful for the patient. Because we have a huge amount of loss of. This is a very important because we have the mode of action. How these our inorganic drugs actually act inside the stomach or the intestine. They may be acting by stimulating the various processes inside the body so that the motility is increased. Bulk purgative, which increase the mass of the fecus from the body. Cathartics or purgatives, they also have a lubricating effect. So there is no problem to the patient. Saline cathartics, again we have here. Now stimulants, as generally we know, they are local irritation inside the intestine and they stimulate the peristaltic movement from the body. So there is motion increase. For example, castor oil, which is normally should be taken once a year also, because normally it is quite healthy for the body also. Bulk purgatives, which increase the main bulk of the intestinal contents so that there is no feeling of indigestion and all that. You may go to and remove the fecals also. Lubricant action also, which is again for the constipation patients also. They have all these drugs, whatever we are using, all the four categories, stimulant, bulk, purgative, cathartic, laxative, they should be such that they can cause smooth clearance from the body. They should not be very much irritating for the body also. We have to restrict excessive loss of the bloody fluid because otherwise the patient may feel nausea or vomiting here also. So here magnesium sulfate, we had discussed this here. Magnesium carbonate reacts with sulfuric acid inside the preparations and all that. We have, it is used as cathartic. We have the properties again, the colorless or soluble in water. It is very soluble in alcohol also. These are the various properties. Another very important topic apart from the various acids, antacids and antimicrobial. Another one is the antimicrobial agents. Now these agents, because when a patient is affected by diarrhea, dysentery or any bacterial infection, they are very important to be removed from the body. So here comes the role of antimicrobial agents. Normally we have some organic or natural molecules, but these inorganic drugs also have a very important role. They can be used with combination of various organic or natural drugs nowadays, but we will stick here to the inorganic drugs for the B Pharma students here. Antimicrobial agents, normally they are classified into antiseptics, disinfectants, germicides, bacteriostatics and sanitizers. Normally we can say here that these all drugs are not for the living person. They may be used for external sources also, just for example disinfectants, sanitizers and antiseptics and germicides also for external sources also. Broadly we have a definition here: antiseptic substances which kill or reduce the microorganism growth. Disinfectants, which are the substances which are used for various external premises, for the lab, hospital environment, toilet and all that, for the home and hospitality cleaning. Germicides, they have a respiratory system which may be used for killing the microorganism. Bactericidal, which kill the bacteria. Then fungicidal for the fungi and the virus is also verified. Next we have bacteriostatic. They exclusively do not kill the bacteria, but they have the power to inhibit the growth of the bacteria or the production. For example, they may be used in sanitizers. Next we have the main mechanism of action. How do these drugs actually work inside our stomach? The main thing is they will go and do something with the microbe which is present inside the body, and they may be breaking their some cell wall or some function outside the cell. Mainly broadly they can be acting by oxidizing the particular cell wall or the bacteria or the microbe. They may halogenate, which is by reacting with the chlorine or the iodine or bromine, protein binding and precipitation. Now we have to be exclusively very safe in amount in the particular halogen which has to be used, otherwise it should be not be harmful for the body also. Example of compounds which act by mechanism of peroxides are quite important. Oxygen liberating compounds which are not very harmful. Next we have mechanism of action. These act by peptide linkages which with the microbes, and they break the function of the microorganism. They also disrupt the specific function of the process so that the microbe is killed, or the very function of the microbe, whether it is bacteria, virus or fungus. For example, we have here various preparations Borax, you must have heard the name. Again, we have tincture of iodine, Lejon soil, flower of sulfur, sodium borate, and alum, potash alum. ये काफ़ी common names हैं. Characteristics again, they should have antiseptic or germicidal activity. If they are to be used externally, they can be germicidal or microcidal also. They should have a very fast action, otherwise they may proliferate the growth of bacteria, microbes or fungi. They should not cause any cell damage. This has to be exclusively kept in mind कि patients या बाहर या external sources पे हमारी body के ज़्यादा नुकसान नहीं होना चाहिए. They should have no systemic toxicity, otherwise if they get absorbed inside the body, then it becomes a very complication if they get inside the body blood. So they should be non-absorbable. We should prefer for these sort of drugs. Next we have here is, for example, iodine. Quite well known example, iodine, povidone iodine, आपने सुना भी होगा. Iodine का manufacture extracting calc से किया जाता है, फिर उसको water के साथ बिना करके various preparations है. सल्फ्यूरिक एसिड मदर लिकर को यूज करके अपन उसको बना सकते हैं. ऐसे दिस इज डन बाय नॉर्मल टाइट्रेशन व्हिच इज कॉल्ड एज रेडॉक्स टाइट्रेशन. द वेरियस methods for titrating with the bases are here. 0.1 molar sodium thiosulfate and a suitable indicator has to be used here. These are the properties and the uses. They are counter irritant and disinfectants. And next we have local germicide action also and other preparations which are quite very important and very well known are the iodine solutions. Aqueous and weak iodine solution you must have prepared inside the lab. Now this is povidone iodine, normally present in versatile hospital clinics. Povidone iodine, KiO3, mainly the inorganic molecule is, and there is a tincture of iodine. Again, pharmaceutics you must have prepared this. Normally we have the aqueous compositions here, weak and strong position. Just there is a percentage of the decreased iodine here, and the more amount of increase, if we increase the iodine, then it will be a strong preparation. Here we have povidone iodine, as you see in the diagram here. This is yellow colored chemical which prevents all the microbes to be entering from the stomach or to be entering from the external area of the body, whether it is hand, feet or other areas. Now bacteriostatic again, which will just stop the bacteria's growth, bactericidal, which kill the bacteria. Next we have the various monographs which are exclusively the official details of any of the drug which is present inside the Indian pharmacopoeia or other pharmacopoeias. Here we have this again same details, hydrogen peroxide properties and hydrogen peroxide as the oxidizing agent, KMnO4, the self here KMnO4 we don't have to use indicator here because KMnO4 itself as a self indicator because it has that pink and white color. Both in the acidic and the basic medium it will give a different color. Here we have the storage and the uses. Next, what is the main volume of strength of H2O2? That depends upon the severity, how much amount of the action we require inside the body. Here we have ammonium chloride, which is the acidifier, which we had already said that some patients who cannot produce acid inside the body, they have to be given this acidifier. Here this ammonium chloride is to be prepared by using ammonia and HCl, NH4Cl. Basically these are the properties, and again the assay, it has to be previously assayed by precipitation titration, gravimetric titration or molar method. It is quite tough, time consuming, so this should be done in priority. The simple one is the acid base titration, which can be done in 1 or 2 hours. Here there are the uses, so they should be stored in highly closed containers. Now I shall thank my friends here. This was all about, I could tell you about GI agents. For further details, you may please refer to the syllabus and the notes which have been provided to you. Thank you. If you have any doubts, please you may ask.